So hello guys, good morning to all of you, and a warm welcome to my live class regarding the this dentistry, and it's related on the quality of life, rather to the oral health related quality of life. So guys, let me just clarify you basic things about the dentistry point of view. In the sense, like, what has happened in the past. Okay, first let me tell you that I am practicing evidence-based dentistry, and evidence-based dentistry deals with common understanding of the concept that the basis on the evidence the treatment plan has to be set, so that it becomes very much clear that we are here to work out on this. Okay. So, like, I just want to sum it up because this is a paper I've taken in which they have really emphasized on digital industry affecting the oral health related quality of life. Okay, so let's come down to the abstract part of it. So, this article has been published in the Journal of Evidence Based Dentistry. It's really a wonderful journal wherein having a good score and a good concept of readability by the people. So they have taken some keywords. So the corresponding author for this is researcher from Germany, because we know that sometimes it is very necessary that Germany plays a good role in research and all. So they have really stressed on many fact that which is ought to be understood by us, that digitization over the past 50 years has taken the roots in dentistry. Starting from computer tomography in 1970. Okay, let me just be live here also. Access. And a comfortable zone is much better than to work. That's it. So, okay, wherein you work on the digital dentistry, where like it's very understood. Over the past 50 years, digitization has gradually taken root in dentistry, starting with computer tomography in 1970. The most disruptive event in digital dentistry was the introduction of the digital workflow and the computer-aided manufacturing, with more new procedures and methods available for dental use. That is the most important thing which I really want to stress, that in dental use, things have gone digitized, wherein we have to stress on the fact that how precise, how accurate, how faster it is. When it is precise, it is accurate, and it is faster, things goes very easy in this case. So let's consider few things that with the advent of new materials, the digital industry workflow has been integrated, wherein we find that it is great that somehow we are now more confident about the predictability of the treatment. So if you consider the lab-based workflow which was done earlier, now we can see that in a conventional lab-based workflow requires a light or chemical curing, and your chairs and processes are developed. But gradually we will know that nothing as such is now. We can easily use CAD CAM, manufacture the things in a wonderful way, and come to a conclusion that yes, these things are feasible for the use in the oral cavity. So, the source of this article is source of the information is a very wonderful Medlar Index article, where we have to consider that these things have really worked hard to you uh, to get a momentum in the dentistry and also improve the practice scenario of it. So, like if it comes down to your investigate material and material, so they are less disruptive and more lesser approaches are there in the, I mean, in the component of environmental protection also. Wherein we have got basically two components that we should understand before we go to digital dentistry. That is your most. important is the most important component being the hardware and the software. How where comes the hardware and where comes the software for this is the most important things we should understand. So exactly if it comes to your hardware, so we have got various CAD CAM machine milling and all, and wherein the milling has been done so that the predictable processes are developed. When it comes to software, things goes very well. There are various software in which we collect data in the form of two levels. One is your still files, that is your beneath the, I mean, above the bone and soft tissue, wherein we take into consideration the soft tissue component of it. And then we have to take into consideration another important point is the bone and the volume, that is the DICOM file. So in this case, again, I'm repeating that this will help us to make it clear how the system works exactly. So then this have a better positive effect on the various most important is the quality of life effect. It affects the quality of life in a wonderful way, wherein we have to understand that it helps in two things, that is prevention of diseases, also therapeutic value. So these components are really wonderful, so that will be able to work out on it. So this is regarding the introduction in the form of abstract. By that also we can also grow in going the deeper section of it and understand the most important component, that is how the system works. So it is a slow and steady method to understand. First of all, the most important thing is that are we enabled for digital dentistry? So before that, we should understand the most important thing, that is the your how to acquire the oral tissue. We as a dentist know that the oral cavity is divided into teeth, gums, your bone, parenchyma bone, hard tissue, soft tissue. But in reality, the concept is how it is interpreted by the computer or the software, so that we can understand the deeper section of it. That has been mentioned. For example, when we are planning for going for rehabilitation, say a dental implant, we are going for it. What we do exactly for it? We check out the 3D location, 3D anatomy for the placement of a dental implant. That is more important thing. Now, how to check out for the 3D location or a 3D anatomy for the placement of dental implant? So we have got some specified dimension of implant. We have to work out for the specified site of the dental implant and the volume of the bone and the quality of bone, the biochemistry of the bone, as a result of which we have to again be considerate that if we place the implant in the mechanical manner, respecting the biology, there will be osseointegration, and then will result a good supporting force can be given dental implants for the processes. Now, this thing is very clear that how it will be great in understanding this, that if we pre-plan the processes, that we know how to share the load and work accordingly, it will be great for us. How we'll do that. First of all, many things are there which help us, like we have got a surface design, a smile design, a architect design, wherein in a bone design, so wherein we check out for various variables for restoring the optimal oral function. So of course that improves the your what we call it as your quality of life of the patient. Now in an interdisciplinary setting, so we have to understand the quality of life of patient in a more specified way. So there are various scales to measure the quality of life. One is your oral health impact profile, your oral health assessment index in child, in a child and also adult. We have got another profile by which we check it out. So in these things, we are like very much clear about it that oral health quality of life can be assessed by understanding this short and important terms. So taken into consideration, now We have got four major area of expertise wherein we check it out for the oral related quality of life. So now it is, first of all, it is oral function. We so there are four dimension actually by which oral related quality of life, oral health related quality of life is mentioned. So the dimensions are very easy. We need to understand that. For understanding it, we have to check it out that oral function, orofacial pain, orofacial aesthetics, and psychosocial impact. So I repeat, there are four terms which is very important, or four construct which is very important for us to understand that in which way we can implement the oral health care to the individual. Those are like oral function, like is the patient able to chew properly? What is the experience in chewing and pleasant or not? And there are others like orificial pain. Are there any orificial pain or any trouble to the patient in which the patient is not able to get ready for the process or face life or the world in a beautiful manner. Your aesthetics makes a social image. It looks out for that component which is intangible, and it is a very much socially demanding one, wherein our communication, our skill, our looks matter, and that helps us to earn our bread. And psychosocial impact, how our personality is going to affect the individual's role. That is, very important is that psychosocial impact, how we are able to modulate the social factors and social cues for this. So these things are very important for us to understand in these articles, and these concepts will help us to get a greater momentum into the quality of life of individuals and practice in a better way. So in digital industry, we should be now there's a turn or a U-turn, you can call it as advancement in digital industry. That is the advent of artificial intelligence. What is exactly the artificial intelligence is? That I will be explaining it. Now, if we consider digital industry to be a big circle, artificial intelligence is subset of it. There are many other subset. This artificial intelligence makes the computer much more smarter. If you take in terms of dentistry and oral health, artificial intelligence make it more understanding for it. Now, AI is a logical subset of digitization that basically uses algorithms and machine learning to automate tasks that traditionally requires human intelligence. That's the beautiful part of it. Now we have got a lot of data set in it, wherein we input them, we calibrate them, we fix it as per the requirement, and we understand that this artificial intelligence will help us to predict the treatment outcome, which is very important for us. Now, what it's not only the treatment, it's about the prevention and diagnosis. It's very much required by the AI, I mean the digitization of the oral health service care. That will help us to understand that most important thing in life, that is your what is the cause of the problem, what can be the probable diagnosis of the problem. So if you take into consideration, the World Health Organization defines prevention as an approach and activity to reduce likelihood that a disease or disorder will affect an individual, interrupting or showing the disorder progression and reducing disability. This is your prevention. But how does digitization industry help prevent disease and disorder? That is a question. So the answer is as such. The first and foremost obvious point in the internal digitization of the dental arches with an internal scanner, now opening up a wide range of diagnostic options. That is very true. Okay. I'll be focusing on the scanner very shortly. We have to wait for that also. And then you can take into consideration there's a question which arises in the mind of the authors, the public, everyone, the stakeholders. How can a thing like scanner improves the oral health related quality of life of the patient or the public at large? So answer is I'm going to tell it out in this for the section. Just need to stress and weight on it so that it becomes easier for us. So, if you take a full hour scan at the annual dental checkup, which can be superimposed on the now, in diagnostic, what happens? We have we have to make it a democratic and a scan for everyone, so that once the scan happens, okay, so the individual can easily get a basic data. The dentist needs the basic data, and then gradually on annual basis we should scan the oral cavity of the patient. It's very hypothetical, but it can be made possible. And then overlap the two things and check it out for the difference in the wear of the tooth and the micro wear, the weight or fashion. That will help us to understand the concept of digital diagnosis. What happens there? There are calculation algorithms which will detect conditions like gingival recession, tooth wear, anatomical changes. Okay, and some of the manufacturers also go for 3D analysis of superimposition of different data set. This allow prediction of increased tooth wear rate due to extrinsic or intrinsic erosion, adhesion, abrasion. So this is very important for us so that we'll be able to understand it, which cannot be apprehended through naked eye. So in this way, we are sure that digital dentistry is evolving, and of course, digital dentistry will be helpful in imparting a proper oral quality of life in the life of the patient. So you consider if you are doing a tooth movement for orthodontic purposes with the help of aligner and start scanning the internal cavity at interim, we can find that after overlapping of it, we can get a better solution out of it. That will be very much entertaining for the patient and easy for us to understand. The more we make the things easy for the patient, the more the best part of it is accepted technology. So, in this, we can predict the tooth movement and tooth outcome. As I told earlier, if you don't predict the outcome, the patient might get confused and might align on the. Now, if you consider various things regarding the diagnosis and then home hygiene, other toothbrush. Suppose we are giving a illiterate toothbrush to the individual. What happens with the illiterate toothbrush? The illiterate toothbrush which we give to the patients are often not oversealed. So if there's IoT or a plain thing in it, you can overseal it so that it becomes a in,